All right. So, Miss Dorothy Dillman, thank you for being with us today. So, when you came here to see us at Columbus Physical Medicine Center, what was going on? What was bothering you?
All of my joints were bothering me. I have 5 different kinds of rheumatology problems, and my quality of life was really declining. I was looking at, in fact, I had already started lining up. I was going to have neck surgery, surgery on both shoulders, and surgery on both knees. And I was looking at replacement of my knees.
Wow.
And I really went to the seminar because I've always been interested in stem cells.
Yeah, tell us about your background. I know you're in the medical field.
I am. I'm a clinical nurse specialist, and I have my PhD in nursing education, and I teach nursing. And so therefore I understand about stem cells being the building blocks of the human body, how they divide and differentiate. And so I've always been interested in it, and I've always wondered would stem cells help me? I'm really aware of how they help other conditions.
So how many months out are we now from you being treated?
I believe it's 5 months.
5 months. And how are you feeling?
I don't have any joint pain, which is the greatest thing in the world.
Wonderful.
Very quickly you were able to help me with the mobility, to restore mobility in my neck and in my shoulders and my knees. When I came here, I couldn't even lift my left arm, and now I'm able to lift it all the way up. I also, and control it. It doesn't just drop down. I haven't been able to kneel, and now I can kneel, which is really good. My muscles are a little sore because I have to do strengthening exercises, but as far as my joints are concerned, there is just no more pain in my joints anywhere. I was also having joint pain in my ankles, my feet, my hips, and that joint pain has gone away also.
And even though you didn't get stem cells in every one of those joints, you still feel that your whole body's benefited from the therapy.
Absolutely, because I got stem cell injections in both knees, both shoulders, and on each side of my neck.
Each side of your neck. Right.
And I didn't expect overnight success. I wasn't looking for a miracle. I know those things take time.
Right.
And but slowly I started having good days and bad days, as you had explained would happen.
Mm-hmm.
But then suddenly the pain was gone in my joints, and I thought it would just be gone for a day or two, but it just hasn't come back.
Wonderful.
That
is outstanding.
And then as it began to, I realized it wasn't in my hips anymore. Once in a while, but as I've gone longer into the recovery, giving the stem cells more chance to work.
Right. So
I believed at the time that if I got that large of a stem cell injection, that it would help all of my problems.
Right.
And I see that it really is. So it's not just still hoping that it will work. I see that it really has worked.
Wonderful.
To the point that my rheumatologist is really excited about the advances or the response I've had to stem cell treatment, and he wants to set up, or he is setting up, research into using stem cell therapy for rheumatoid arthritis patients.
Wonderful.
And I have 5 kinds of rheumatology problems, and he didn't expect it to really help all 5, and it has.
Wonderful.
So it's great.
That's excellent, and we'd love to hear stories like that. Thank you for sharing that with us.
Oh, it's certainly my pleasure. Thank you very much for all that you've done for me.
Oh, you're welcome. Thank you.